in terms of the clinical signs, I mentioned before, some of these horses can have that sort of sawhorse stance where they're standing with their front feet out in front of themselves and they want to tend to, dig their heels into the ground. That's a pretty sort of typical acute laminitic stance, that we'd see in a pasture-associated laminitis, for example, in a pony with equine metabolic syndrome. But they also may be weight shifting. They might be shifting from one foot to the next fairly frequently. They may be reluctant to stand on one or more legs when you lift them up. They may have an increased digital pulse to one or more legs. There may be some heat around the coronary band, but that's not always consistent. And sometimes if your vet or farrier comes out, sometimes they'll have a pain response to hoof testers. So if we squeeze over the toe, sometimes they will be painful. I think, hoof testers aren't necessarily the be all and end all. There's certainly a lot of horses out there that have laminitis that don't test positive to hoof testers. They don't have that pain response. So I think that's sort of important to know. So that's sort of a bit of a basic rundown of a laminitis case. And we've got a couple of photos in front of us there that are mainly chronic laminitic horses. So the image on the top left-hand corner is a laminitic pony that has, you can see these really obvious growth rings running down from the hoof wall when this horse has had a couple of laminitic episodes over the last 12 months. You can see at the toe, it's quite stretched and flared. And so that's sort of a chronic laminitic foot. The same with the photo on the right. You can see that right at the toe, there's this sort of stretching of the lamellar attachment right around the tip of the sort of the front of the hoof here. And then this final image on the sort of left-hand bottom area is this sort of lamellar wedge. So that the area where this lamellar attachment is really sort of pulled away and it becomes disorganized and kind of has this funny sort of look to it.
So these horses there, Luke, they're all chronic, they'd all be quite lame, quite obvious.
Yeah, I think the top left horse, that horse is not really that obvious. It's definitely got chronic laminitis. That's probably in a case that has equine metabolic syndrome, or maybe it has some fairly, it has like a controlled Cushing's disease. The bottom two images though, particularly that bottom left, you can see how far up that hoof wall that lamellar attachment kind of goes. I think, can you see my mouse?
Yeah.
Oh, okay, cool. Oh, that's easy. You can kind of see how far up this lamellar wedge goes. Like they've got this, it's this really obvious ring here. So this horse probably only has about, sort of 25% of its hoof capsule is well attached. And the other 75% is pretty damaged. So that horse is obviously going to be reasonably lame. It does have a reasonable, I know this horse pretty well. I've, seen the x-rays of it over the years and has a reasonable amount of sole depth under the tip of the pedal bone, which we'll look at later on in the piece. But, this sort of foot here, this horse is definitely going to be lame, mainly on the turn, but it's, that's a huge amount of lamellar detachment going on in this foot. And it's the same with this horse here with this really, really stretched white line. That lamellar stretching goes all the way round from the quarter all the way around to the other quarter. So this horse doesn't have a great deal of integrity to its hoof. If we look at this other image up here, you can actually see this part of the hoof wall, probably about 75% of it is actually, although it's got these little growth rings, it's actually in not a bad orientation. It's just this last 25% it's sort of diseased and flared out. So this is more likely to be a horse that's kind of recovering from laminitis, maybe depending on the size of the horse, 6 to 9 months through the the rehabilitation phase. Whereas this horse is probably only in the first 3 months, and he's got another 9 months left of growth to kind of grow out this lamellar wedge. And we'll talk a little bit about it later, but I had a conversation with someone today, and we sort of talked about can we actually grow this lamellar wedge out? Because back 10, 15 years ago, people were saying no, you can't really grow it out, but even if this is a mild case, you can kind of see that it does really start to grow out over time with the right, sort of management, including diet, what we put on their feet, how often they're trimmed, all of these sort of things that are really important.